Welcome to another episode of the Environment in Canada podcast, a podcast about the environment in Canada by Sierra Club Canada. I'm Melody Lee, Communications Assistant at Sierra Club Canada, and today's episode takes us on a deep dive into the hidden ways toxic chemicals shape our health, our communities, and our policies. I'm joined by Dr. Bruce Lanphear, a physician and public health scientist whose research has reshaped how we understand the health effects of low-level toxic chemicals like lead, air pollution, fluoride, and pesticides. For more than 3 decades, his work has shown that small exposures can have large, lasting effects on children's development and population health, helping drive prevention-focused policy around the world. Together, we explore why there is no safe level of lead, how industry has influenced environmental science and regulation, and what decades of on-the-ground work with affected communities reveal about environmental injustice and the global export of harm. This episode also examines how personal experience intersects with scientific research, why prevention must take priority over treatment, and what practical actions, both individual and systemic, can help reduce toxic exposures and protect future generations. Before we begin, just a reminder that you can take action on environmental issues by visiting sierraclub.ca. We have tons of petitions, other actions and events, and regular news updates you can sign up for on our homepage. You can also find Sierra Club Canada on social media, and you can listen to the Environment in Canada podcast on the Harbinger Media Network, Spotify, Apple Podcasts, iHeartRadio, and YouTube, or wherever you get your podcasts. This podcast also airs on CKUT Broadcast Radio in Montreal, 90.3 FM, bi-weekly on Tuesdays at 11 a.m. Eastern Time. Don't forget to click follow or subscribe so you get the latest episodes from us. Hi Bruce, how are you?
I'm doing well. How are you?
I'm fine, thanks for asking. It's hard to believe it's been more than 2 years since we last spoke. It was also like this, virtually through Zoom, and so thank you so much for accepting my invitation to be my guest on today's episode, especially on such short notice and with the holidays just around the corner. So really appreciate that. It's a true honor to have you on this podcast today, and I'm confident that our listeners will gain a tremendous amount from our conversation today. So thank you so much.
Thank you. Thank you for having me.
Okay, so to start us off, could you briefly introduce yourself and the work that you do for those tuning in?
Yeah. My name is Bruce Lanphear. I'm a public health physician, and I've been studying how to protect people from lead poisoning for over the past 30 years or more. And as time went on, I began to look at other chemicals as well. So across North America, everything from lead to pesticides, fluoride, tobacco smoke, air pollution, quite a lot of the toxic chemicals that are found everywhere and in many cases are found inside of us.
Thanks so much, Bruce. That's a great overview. To kick things off, looking back to the start of your career, you were once advised to get out of lead research because blood lead levels had dropped and the problem was going away. What made you decide to stay? And over the course of your career, how have you seen industry influence the science in environmental health, for example, through corporate pressure or manufactured doubt? And what has that taught you about how public health really works?
Yeah, so that's a lot. I was just starting my career. I was in Rochester, New York at the University of Rochester, and we were studying how much lead and house dust was dangerous for kids. And just as I was really launching this career, we did see blood lead levels plummet across the United States. Mm-hmm. And even though I had been advised that the problem was going away and there wouldn't be any money, there were a couple things that held me back from just moving on. And one was that even though blood lead levels had plummeted so that it went from about almost 90% of kids having a blood lead level in excess of 10 microgram per deciliter, down to about 5% across the United States. There were still hotspots, cities where 1 out of 3 children had lead poisoning. And so, even though nationally it wasn't as big of a problem in many cities across the United States and elsewhere, and as we'll talk about later, are now across the globe, there were still many children who were lead poisoned. New York City, Providence, Chicago, St. Louis, Rochester, and many other cities. And so that was one of the main reasons. The other reason is that this idea that there were safe levels, that 10 microgram per deciliter, which is equivalent to 100 parts per billion, was safe, was more convenient than it was based on science. And so we began to ask questions about whether there were effects below 10. And already there were some clues that there were. And so those two things kept me focused on lead poisoning in particular, and for a long time on children. One of the things that shifted my attention to look at adults, well, a couple of things. One was Ellen Silbergeld, who's a brilliant and sometimes mercurial toxicologist at Johns Hopkins, kept pushing me that I needed to study adults as well as children. But the other thing was there was a National Toxicology Program panel in 2012. This was based at the National Institute for Environmental Health Sciences. And we reviewed all the evidence at the request of NIOSH, the National Institute for Occupational Safety and Health, what effects we could see at different blood lead levels, at 5 microgram per deciliter and at 10 microgram per deciliter. And we came up with a table that put all of this together based on the best available science. And one of the outcomes, coronary heart disease, I was convinced we did have enough evidence, but others said no. And so I wanted to better understand why they were convinced there wasn't a causal relationship. And so I spent the next 10 years trying to understand this. And what we found convinced me that lead was a risk factor for coronary heart disease. And that begins to open up a whole different dimension, because what I realized in looking at the history of lead poisoning is that it was known back in 1925, if not earlier, that lead was a risk factor for atherosclerosis. In fact, we were warned in 1925, before lead was added to gasoline by Yandell Henderson, that lead was going to cause a scourge worse than tuberculosis if it was added to gasoline. And he went on to say that it would cause slow lead poisoning and hardening of the arteries. There was an argument, a pushback by an industry representative, Robert Kehoe, who said, look, we know lead's a poison, but until you've proven it's a poison at the levels found in gasoline, you have no right to prohibit us from using it. And based on that argument, which is now called the Kehoe Rule, we've now seen a century of lead poisoning with an increase in coronary heart disease or heart attacks over the past century, hypertension, learning problems in kids, ADHD, and perhaps even criminal behavior based on that argument. And that industry argument, the Kehoe Rule, really has sort of set the stage for how we, quote, regulate chemicals, which means to say that if industry can convince us with 1 or 2 small studies, usually mice or rats, that a chemical is safe, we have no right to prohibit them from using those chemicals until we've proven time and time again that they're toxic in the laboratory setting or in human studies. And that's kind of the mess we're in. The fix we're in is we've set up this contract in a way that basically says we're going to protect industry over the rights of Americans to be healthy.
Yeah, that's a powerful overview. Thank you. Those historical examples really show how industry arguments shaped regulation. I want to stay with that for a moment and dig a bit deeper into the science that challenged those assumptions. So, your research has been central to the idea that very low levels of toxicants, like lead, can cause measurable harm, especially to children. So, that's an idea that really challenges the long held assumption that there's a safe threshold for exposure, and that's a really hard idea for many people to grasp, myself included. So, for listeners who may not be familiar with the science, can you summarize the key evidence behind the no level is safe conclusion and describe how stakeholders, including industry and regulatory bodies, reacted to those findings and what that reaction meant for your work? So, for instance, did that reaction lead to any professional pushback or consequences for you?
Yeah. Well, I think maybe to begin with, to understand that this idea that there are safe levels or thresholds was an assumption. It was a big one, but it was an assumption that was made 60, 70 years ago when people were grappling with this idea that they knew chemicals could be poisons, right? Whether it was lead and arsenic that's used as an insecticide, whether it was DDT. We knew there were levels that were poisonous. How would you set up a system to protect people from those chemicals without upsetting the economy, the industries? And so for several years, they sought to find ways to study this, to find safe levels. And they kind of gave up and said, look, this is really hard. We're just going to make an assumption. And we're going to assume for carcinogens that there's no threshold. But for non-carcinogens like lead, they assumed that there was a safe level or a threshold. It was just a big assumption. That was all it was. And so that was sort of the playing field when I first got involved with lead. And because people first said, look, there's no problem below 10 microgram per deciliter, and the problem seems to be going away. Both of those, in a way, sort of set up this challenge. And that was to test this, to test whether there were effects below 10, particularly for children, which is what I was focused on at the time. And so working with a team at Cornell and Rochester, and then later on at the University of Cincinnati, we began a series of studies, first using NHANES, a national survey, to look to see what happened down at the lowest measurable levels for children's reading and math scores. And what we found was that there was no apparent threshold, that down at the lowest measurable levels, as blood lead levels increased, we saw decrements in reading and decrements in math scores. There was no evidence of a threshold. In fact, we saw steeper decrements at the lowest measurable levels. We'll come back to that in just a second when we talk about IQ scores, but we then went on to look at stronger study designs. That one was a cross-sectional study. We went on to look at this in our cohort that we'd assembled in Rochester. And what we found there was the same thing, but now we had a prospective cohort study where we'd followed kids from childhood. We knew their mother's IQ scores. We knew whether they were born premature. We know their socioeconomics. So we could adjust for a lot of other things. And we saw the same pattern, that first 10 microgram per deciliter, down at levels that were thought to be safe, we saw a 6 to 7 IQ point decrement as blood lead levels increased from 1 to 10 microgram per deciliter. And that drop in IQ was larger than the drop from 10 to 20 microgram per deciliter. So not only did we see no evidence of a threshold, we actually saw greater harms for an increase in a certain exposure at the lowest measurable levels. That's called a decelerating dose response curve. Now, that initially was sort of diminished, and in fact, there was a lot of pushback. This was under the George W. Bush administration, and I had been invited, along with 3 other colleagues, to serve on the CDC Lead Poisoning Prevention Committee. But with this new research coming out that was going to be used to say there was no safe level, and we needed to shift more of our attention to preventing exposure, not treating lead as a medical problem and waiting until kids were lead poisoned to do something about it. That's when I was kicked off of that CDC Lead Advisory Committee. Within a few months, I was also disinvited from an EPA science and research working group. And then the Commission for Environmental Cooperation, which was a trinational organization that was trying under NAFTA to balance out environmental regulations across Mexico, the United States, and Canada. I was also on an expert panel for children's environmental health. And I was disinvited from that once Bush's administrator was put in charge. And so there was this pushback, particularly under the Bush administration, because they were very friendly to industry. I was still a relatively young investigator, but it seemed like this was something that we had to really push for. But it took several years to get past that and for the science to be acknowledged.
Yeah, that must have been an incredibly difficult experience to go through. Thank you, Bruce. That's a really compelling account, and it clearly shows how deeply entrenched industry arguments have shaped regulation, even in the face of strong evidence. At the same time, it really underscores just how important this research is, especially the conclusion that there is no safe level of exposure. I know that idea can be difficult for many people to grasp, myself included, but it's clearly a central and powerful finding of your work. That actually leads me to a related question. So, I remember learning in an undergraduate toxicology course about the widespread use of lead based paint in the 1960s and 70s, particularly in older housing, and how young children were often exposed through licking the paint on the walls in their homes. I'm just wondering whether you've studied or followed those children who grew up in those environments and what your research has shown about the long term effects on health for those children who have been exposed to lead paint in housing.
Lead was actually used for centuries in paint. I mean, it can help brighten certain colors. It's durable. It can breathe. And so it's been used in paints for quite some time. In fact, Francisco Goya, during his Black period, may have had deafness and years long of illness from chronic lead poisoning. And so it's been with us for centuries. But with the industrialization of paint, there was lead added to paint for the same reasons, that it helped chalk off and leave a nice smooth surface. It was durable and so changed with the temperatures. And even though in the early 1900s, it was very clear that lead paint was an important source of lead poisoning for children in Australia, the paint company continued to use it. And you can go back and find all this history. Lead paint was used widely around the world, including in the United States, up into the 1940s. And then there was a voluntary reduction in the amount of lead used in paint because it was needed for the war effort for World War II.
Oh, okay.
So the paint companies at that time voluntarily reduced the amount of lead in paint down to 5% or less, but it continued to be a problem. Yet if we go back and do these surveys, which was done by the U.S. Department of Housing and Urban Development, you can see that homes built before 1940, about 40% had one or more lead paint hazards. If it was built before 1960, it was 3%. And so the risk changes over the past century. We should be particularly concerned about those homes built before 1940, before that voluntary reduction in lead paint. By the time I got involved in this in the 1990s, so many decades later, we really hadn't dealt with this housing stock that contained lead hazards. And to a large extent, we've made some progress, but we still have a lot of housing, millions and millions of houses across the United States that still contain lead hazards.
Okay.
When I first got involved, in fact, it was the first President Bush, George H.W. Bush, and his wife Barbara had a dog that was lead poisoned in 1990 from renovations in the White House. And they were, of course, quite upset by that. And Louis Stokes, who was a congressman from Cleveland, had a front page Washington Post article that talked about this testimony, which was basically saying, Mr. President, were troubled by this as well. But did you know, Mr. President, there are 3 or 4 million children in the United States lead poisoned every year? And that led ultimately to the Lead-Based Paint Hazard Reduction Act by Congress. And that mandated that a study be done to identify what levels of lead in house dust were dangerous. And that was a study that I did in 1995 to try to come up with a dust lead standard. And it had a lot of promise because you could go into a home before a child moved in, before a child was born, after abatement or renovation, and you could take a dust sample. And from that sample, you could identify whether that house was going to poison a child or was likely to poison a child, right? So this could be a really important tool. Unfortunately, the EPA misrepresented the data because they didn't think it was feasible to get levels down to the point we said was safe. Now, that was not true. When we proved later on it wasn't true. But the EPA, in many cases, does what they think is feasible, not necessarily what the best available science says. So it actually took almost 30 years for that science that I did when I was a young scientist and 2 federal court cases for the EPA to use the science and put the dust lead standards down at the level that they are going to be protected. It takes a long time for these standards to be put in place, too long.
Yeah, thank you. Yes, that history really highlights how persistent housing hazards are. It's sobering how widespread the problem remains and striking how long it can take for solid science to translate into standards. So, moving from housing to broader community impacts. So, you've worked with communities affected by industrial smelters, right? And have seen similar patterns play out across borders. Can you describe moments from that on the ground work that you did that shaped how you understand industry behavior and environmental injustice? And what those local and transnational experiences taught you about global pollution dumping and the export of harm?
Yeah. Yeah. One of the first communities I was involved with was Herculaneum, Missouri. This was a primary lead smelter in the United States, about 30 miles, 40 miles south of St. Louis. And for decades, the children in that community, just around that smelter, there was evidence that they were lead poisoned, but the community was really struggling with it because this smelter was part of their livelihood. They depended upon that smelter. But then something happened. The workers went on strike, and because they were no longer dependent on that smelter, they started to be able to actually acknowledge that their children were being lead poisoned by the smelter. And so that's when my research was just being published, and they'd reached out to me, and the Missouri Department of Natural Resources used that study to ultimately close down the smelter. That
Yeah, so
was,
your research was really life saving for them. Super life saving.
well, it was in a way, but then what happened next was also something that I still regret, and that was the company, Doe Run, closed the Herculaneum lead smelter, but bought the smelter in La Arroya, Peru, and promised to make technological improvements so that children wouldn't be poisoned, but failed to do so. And so we saw the lead levels of children in La Arroya spike after Doe Run bought the smelter. And so we'd helped to close down the smelter in Herculaneum, but then increased production and poisoning in Peru. And this same pattern has been seen again and again, whether it's leaded gasoline or DDT or other toxic pesticides, that once we ban or restrict their use in the United States or Canada, the companies shift the market to industrializing countries. And so now, today, 1 in 3 children around the world are lead poisoned. That is, they have a blood lead level over 5 microgram per deciliter, which is like 50 parts per billion of lead in their blood, and much more in their bones, where most of our lead is stored. And so we see this same pattern again and again, whether it's lead gasoline or whether it's asbestos. In Canada, for a number of years, the Canadian government, the federal government, supported this export of a toxic carcinogen, asbestos, to other countries like Pakistan and India. And so we keep seeing this same pattern. We're doing this to ourselves. We're killing ourselves with these toxic chemicals. And we call it good for the economy, but it's really bad for public health.
Thanks, Bruce. Yeah, that's distressing and really illustrates the export of harm. So, moving from those community impacts to communicating the science more broadly and publicly, after hearing about both the science and the people affected, I just want to ask you about how that translated into public facing work. So, you've moved from publishing academic research to launching Little Things Matter, which translates science into concrete tips and campaigns for parents, teachers, and community leaders. What pushed you to make that shift, and how do you balance scientific rigor with the need to communicate urgent messages simply and persuasively?
Yeah. Well, it's an ongoing challenge. The idea to try to take information and make it more widely accessible, to try to get rid of the jargon and find ways to make it accessible. I first got involved with this because I realized probably about 15 or 20 years ago that trying to change federal policy, while important, wasn't enough. That too often the federal policy didn't change until there was either a crisis, like Flint, Michigan water disaster, or there was so much community outcry, public outcry, that our politicians could no longer ignore a problem. And so you can almost imagine it where we've seen this so many times that industry more often has a much bigger voice than the public, and certainly than a few scientists. And so, even though we may find evidence consistently that something is like lead is toxic, nothing really changes until there's a big enough pushback to counter the powerful message of industry, in this case, the lead industry. So I began to try to find ways to craft this message for the public so that once they understood, I surmised, we might begin to see changes in how we vote, what we demand of our politicians. And I think it is changing. It's very slow, but it is changing. And it's not a surprise that it takes so much time because, again, there are so many powerful interests pushing back. I mean, this social media platform that we created, Little Things Matter, we operate maybe $50 to $100,000 at most every year. There are millions, if not billions, put in to counter that by industry. And it's like a mouse trying to defeat a dinosaur, a giant. And so until we find ways to balance that out, I think we're going to continue to see a lot of death, disease, and disability from man made industrial sources. Let me frame it a different way. And I realized this about a year after I moved to Canada. If you want to understand why there's so many policies, let's talk about the United States for a minute because of the context we're in.
Mhm.
There's so many policies that don't make sense. Why don't we have maternity leave in the United States? Why doesn't everybody have access to universal health care? Why don't we do a better job protecting people from environmental chemicals and pollutants? Well, the United States is being run like a corporation by the mega corporations. And the mega corporations are like majority shareholders of the government. Each of us as citizens are minority shareholders. And until we can bring together enough of the minority shareholders to push back against the vested interest of these majority shareholders, we're not going to be able to make a solid argument to protect us. So that's really the dilemma, that we've got to find a way to bring people together. And of course, right now, we all know how polarized things are in the United States. And I think that's part of the strategy. as long as these industries can keep us polarized, can keep us fighting, they can get away with whatever they want. And so that's what we've got to figure out, is how to help people appreciate across the aisles, across different groups who have maybe seemingly different interests. Some people are fighting for better breast cancer treatment. Others maybe for ALS treatment or Parkinson's or protecting kids. And in the end, while every one of those things is really important, as long as our interests are fragmented, fighting for this cause and that cause, and we don't come together to say all of these are related, that if we really push back against industry and demand that we do better prevention-oriented science, that could help us prevent breast cancer and ALS and autism and lung cancer and name your disease of interest. We won't do it because we're all fragmented and we're not working together.
Thank you, Bruce. That framing is really powerful, especially the idea that prevention stalls when public voices are fragmented and industry interests dominate the conversation. It makes clear why translating science for the public isn't just about awareness, but about building that collective pressure for real change. So I guess this is something I probably should have asked a bit earlier, but since you speak so passionately about this work, and because so many scientists say their research interests intersect with their personal lives, I'm just wondering if that's true for you also. Like, have any personal encounters or family experiences shaped the urgency or direction of your work?
Yeah.
And if yes, yeah. Okay,
Yeah.
go ahead. Yeah.
Yes. Thank you. Absolutely. The list is probably too long for me to go on, and I'll try to be succinct. Once you begin to look and you know where to look, you begin to realize that every one of our families has been impacted in big ways by environmental exposures. I'll give you just a few examples. First, when my wife and I were pregnant with our second child, she was a pediatrician at Strong Memorial Hospital in Rochester, New York. And like any good pregnant woman, she was making sure she had her 8 or 10 cups of water every day, and she would go fill up her water bottle from the water fountain down the hall. About week 14, she had a miscarriage. And we didn't think of it other than, well, this happens. But later on, about a year later, we found out that those water fountains had levels of lead between 700 and 1,500 parts per billion. This is extraordinarily high. And while we can't say that that caused her miscarriage, we can absolutely say that that increased her risk for having a miscarriage. Second series of stories, I've got 6 uncles. 2 of them had Parkinson's. When I was talking to Ray Dorsey at an event we were at together in Palm Beach, I brought this up. Ray Dorsey is a neurologist who specializes in the causes of Parkinson's. And he said, well, what work did they do? And I said, well, one was a welder, manganese exposure, he said. The other one was a machinist, TCE or trichloroethylene, he said. So 2 of my uncles died from workplace exposures or environmental exposures, if we think about it more broadly. Another one died from bladder cancer, and he'd worked at a dye company. Another one died from chronic renal failure and had lived above the chauffeur's shop as a young kid, where they sold leaded gasoline, and then worked as a carpenter for his life. And carpenters are often exposed to lead. So when you begin to look carefully, you begin to see how much our family's history is a function of the exposures that we have had. Another example, in 2007, my dad called me and said, I've been diagnosed with ALS, Lou Gehrig's disease. And of course, as an epidemiologist, I wanted to know why him. So I started to look at the literature, and 3 things stood out. Head trauma, check. He had head trauma as a 45-year-old man in Kenya with a scooter accident that was severe enough to put him in the hospital and develop amnesia. Second risk factor, lead exposure. He grew up with his brothers, Perry and Hank, above the Lanphear garage where they not only repaired cars, but pumped leaded gasoline. Then at age 5, they moved to the family farm, Broadview Farm, which was downwind from the golf course that used pesticides. Lead exposure is a risk factor. Pesticide exposure is a risk factor. And not only was he exposed as a child, he went on to work at the golf course for 2 years. And then he was a horticulturist that worked with pesticides. Check, check, check. Now, once again, we can't say that any one of those or all three of them caused his ALS. That's not possible. But we can absolutely say that each one of those, and collectively all three of them, increased the risk that he would have acquired ALS. And so we've had, just with my family, right? Just with this small family, I can tell you a number of people that either died or had conditions from the exposures in our environment. And my experience is not unusual. It's typical. If we started to look, we would see this again and again.
Thank you for sharing and for being so open, Bruce. I'm really sorry to hear all that. And hearing how common these stories are is truly sobering. So, I imagine many of our listeners will want to act, not just understand all these problems. So, what are the most evidence based, high impact steps people can take in the next week or month to reduce exposure to toxicants for both children and adults? And how do you think organizations like Little Things Matter can support communities as they make those changes?
Yeah. Well, by itself, Little Things Matter will have a little impact, but there are things that people can do in the short term. So let's start with the
The
short
little
term.
things can add up, right? Little things
Little
definitely
things
add up.
do add up, but we don't want to wait that long. So we really need a lot of people to
All
pull
right, good
together.
point. Good point. Okay.
Yeah. I think in the near term, I think there's some simple things we can do, and it's about our daily rituals. We can avoid pesticide use and smoking in and around the house. We can, whenever possible, choose organic over conventional food. Avoid food that contains packaging or highly processed foods. Avoid canned foods. And this was the hardest for my 3 children, my daughters. Avoid the use of cosmetics and fragrances. Minimize how many of those you use. Those are some of the steps we can take each day that will reduce our exposures. We have evidence that they will reduce our exposures. Some things that'll take a little bit longer that we can do in our house, getting rid of old furniture that contains some of those chemical flame retardants is important. We might want to bring a HEPA air cleaner, a portable HEPA air cleaner in our home, particularly when there's forest fires. But if you live in a community where the levels of air pollution are high, and frankly, most of us live in places like that, the HEPA air cleaner can be an interim step. So these are day-to-day things we can do. It does take some time. I mean, getting rid of those Teflon pans, for example, shifting away from plastic serviceware, not using microwaves and plastics. Those are things that we sort of have to retrain ourselves, but they're all doable. They're doable for most of us, but they're not enough, right? Those will bring down our exposures. But even somebody like me that studied this for 30 years, I can't protect my own children or grandchildren without the help of our regulatory agencies and our politicians. That's where we need to take these regulatory steps so that in the next 10 to 20 years, we don't live in homes that contain that old lead-based paint or have lead service lines that bring lead to our drinking water,
Right.
right? Or use
Yeah.
pesticides that we know are toxic. Right now, we in Canada, we're fortunate enough that in the past few years, we got rid of paraquat, a pesticide that causes Parkinson's, and chlorpyrifos, a pesticide that damages children's brains. But it took us 40 years to get to that point. So Canadians were being exposed to these toxic chemicals for 40 to 50 years, right? That's way too long. Now we've gotten rid of them. That's good. Not in the United States, where pyrophos is still being used, paraquat's still being used. In fact, production's been increasing. So we still have a long way to go, and that's the most important steps that we need to take. In the short term, certainly we want to have some control over our exposures in our home and our day-to-day life. But the most important thing we need to do is demand from our politicians and our corporations that they do a better job and stop using chemicals that are known to be toxic, and change the regulatory system so that we're not continually putting new toxic chemicals that will later be shown to be toxic into the environment.
Yeah, that's really helpful. Very practical, clear, and easy to understand. It's also a strong reminder that lasting protection depends on meaningful policy change. Yeah, very insightful. Okay, so we've definitely covered a lot of difficult ground today. You've shared not only your research experiences, but also how your work intersects with your personal life and your family's experiences. It's good that you've been able to channel that grief, frustration, and pain into such important and meaningful work. But I'd like to end on a more hopeful note and talk about where change is possible. So, after decades of studying toxic chemicals, what have you learned about how real change happens? And what gives you hope that we can finally reduce exposures that have been harming people for generations?
Yeah. But change really happens when several things come together, when we have good science and when the public demands change. Now, sometimes that happens after a crisis, which we prefer not to have to go through again. But that's when change begins to happen. And despite the fact that what I've talked about today sometimes seems hard and just troubling, the idea that most of the chronic disease that we're experiencing today, that kills us today, is man made. And toxic chemicals and pollutants are one of the big contributors to that man made epidemic or pandemic of disease that we're experiencing. That's the troubling part. The hopeful part is that means that we can control many of these diseases. We can reduce these exposures and bring down those diseases. And we've seen that. We've seen heart attacks have declined since the peak in 1968. And that was also the peak of the use of leaded gasoline. We've seen heart attacks decline precipitously as lead was taken out of gasoline. We've seen lung cancer come down as people stop smoking. So we know that we can bring about these changes. That's the hopeful part. But it means we've got to figure out how to take ourselves away from all these other distracting things and put enough attention in the short term to solve these problems, because it won't be easy. It's like trying to maintain that democracy, right? It takes work. And if we want to protect our families, whether that's families today or children and grandchildren, we've got to focus enough on these issues so that they're healthy, that they're not dealing with the same toxic chemicals that we're dealing with today.
Yeah. Thank you, Bruce. That's such a powerful way to frame it. It really brings everything full circle: the science, the policy, and the human stakes. It's sobering, but it's also deeply hopeful to hear that so much of this is preventable if we're willing to do the work. So, to close us off, if there's one action or policy win you would encourage listeners to support, what would that be?
Well, I think if we had to choose one thing, the idea of building into our constitutions, which over 150 countries have, this right to a healthy environment, to put it into our legal system that demands change, which is going to take some time, but it sets in place these principles that we should all live in healthy environments, and that our governments have a responsibility to make sure that we live in healthy environments. I think that would be the thing I'd focus most on.
And I 100% agree with you. I think that's a really strong note to end on. Thank you so much, Bruce, for joining us today. I really appreciate it.
Thank you, Melody. Happy to do it and glad to be part of this.
Thank you so much again. Happy holidays.
Happy holidays.
All right. Thank
Bye-bye.
you. Bye. Before we end today, just a reminder that you can take action on environmental issues by visiting sierraclub.ca. We have tons of petitions, other actions and events, and regular news updates you can sign up for on our homepage. You can also find Sierra Club Canada on social media, and you can listen to the Environment in Canada podcast on the Harbinger Media Network, Spotify, Apple Podcasts, iHeartRadio, and YouTube, or wherever you get your podcasts. This podcast also airs on CKUT Broadcast Radio in Montreal, 90.3 FM, bi-weekly on Tuesdays at 11 a.m. Eastern Time. Don't forget to click follow or subscribe so you get the latest episodes from us.